Good afternoon or evening, everyone, and welcome back to the 4-in-1 virtual town hall. Today, we are going to be going over the EMEDS positions, and we have Tech Sergeant Select Aguilar and Tech Sergeant Smith with us, joining us, and I'm going to go ahead and hand it over to you, ladies.
All right, good evening. I am Staff Sergeant Aguilera. Currently stationed out here at Joint Base San Antonio, Camp Bullis. We are on the north side of San Antonio.
Hello, good afternoon. I am Sergeant Smith. I'm also a Camp Bullis instructor at MRTC. Been here since 2017, been in the United States Air Force for 13 years. So thanks for tuning in. So basically, we are the EMEDS instructors at Camp Bullis. We're the SME 4-in-1 surgical technicians out here. Some of the things that we do in the operating room, we basically have different AFS, or not really all different AFSCs, but they'll come into the operating room and we, I don't want to say we really critique them, but we just kind of go over different scenarios. So we have something called a DMBI, and that basically is something that says what injuries that the patients that come through the operating room are going to get. We have hired contractors that come out and they'll specifically give those injuries to the LPMs or our mannequins, whatever our scenario is tailored to. At that time, we'll walk the, not just the surge tech, at this point, we kind of even help out some of the surgeons with some of the different procedures that we have out here. The different courses we have, like I said, we have EMEDS, we have EMRC, and we have our ground surgical team phase 2. Just some of the few things that we have. But overall, you're just going to be a SME. That's basically, you're going to have to understand everything that happens in an EMEDS, and then everything that happens for a ground surgical team.
So some of the requirements that you need to have before you come out here. So of course, you have to be either a staff sergeant or a tech sergeant. It is preferred that you have your CCAF or receive it within the first year. And whenever you are transitioning here, and as soon as you get here, you'll go through BIC, which is our basic instructor course. I know some of y'all who have taught phase 2, SSA phase 2 or SSA phase 1 and pick up this. If you've already had BIC, then you wouldn't have to go through that. Schools for the job. So again, yeah, we already covered TCAF. Training and rank. Do you have anything else? BIC.
No, that was good. As far as our workload hours, it's going to vary, especially based on COVID right now. Right now, we have just a little bit of downtime when we're not doing our courses. For instance, right now, we have 2 weeks off where we are teleworking. So even though we're not here, we still are responding to emails and we're still getting prepped for our next course, which is going to be the 14th of September. But usually you can anticipate about 2 courses per month. And they're pretty long. So your normal day will start from about 6 and it'll be over around 1700. That's on a course week. It is very hot or cold. This has to be a job that you want to do, that you like to do in order for you to like it here. And it is 4 years, and that's a very long time. Well, actually, they made it go to 3 years, but 4 years is a very long time. So this is something that you definitely want to make sure that you want to do and be out here.
So just to talk a little bit more about other things that we do. So during those the weeks off that we have, we are also running our EMRC, which is our tech school training. So that's on Monday and Tuesday. It normally falls on Monday and Tuesday, but like, for example, next week, we have a holiday on Monday. So we'll run it on Tuesday and Wednesday. So just to kind of give you a perspective, that happens every week throughout the year. I believe there's only 2 times out of the year that does not happen. And unless something happens like with COVID or something, that it has to get canceled. But I did want to correct myself. I'm sorry, both slots are staff sergeant slots for out here for EMEDS. And then what made me want to join, or what made me want to come out here to Camp Bullis, I actually really love the outside, and it was nice to get a different perspective on different things that we could do in our job. I love Texas, and I grew up in this type of heat, so I'm okay with it. But the biggest thing that actually impacted me was Master Sergeant Almeida. I came out here in 2015 as a student, and I just saw the way she worked, the way she taught, the impact she had personally on me. And I definitely wanted to do that with other students or other people who come through and who are set to deploy.
Other reason that I decided to be an EMEDS instructor was, number one, I absolutely love instructing. I love teaching people. And I thought that it would be super cool to come out here and actually apply my challenges and issues that I had when I was deployed to some of the students that I've come in contact with. And that's actually one of the things that I've been able to do while I've been out here. So I absolutely love it. What it says, what do you dislike about this job? The only thing I would say that I dislike, sometimes, just to be completely honest, it is really hot. It gets so hot sometimes, and it's just one of those things where you just you kind of forget what you're saying. It takes away, and it's very, course week, it comes. So a course week will come, and then you'll have a week off, and then you get another course week, and then you have another week off. So it's just like, you know exactly what's going to happen again. But when you get to meet the different people, and you get to say that you have impacted their lives in some way, or if they came, maybe not as confident, or they were a little nervous or concerned about something, and you know that you were able to tailor or give them some advice or help them to do something with the technique that you showed them, and ultimately impact the way that they scrub or could potentially save someone's life downrange, is just, it means a lot. It's very, it's very cool to say that I have a part in something like that. So.
And some of the dislikes I had was, I was a newer staff sergeant when I got here. So I had been a staff sergeant for about 8 months. Yes, I did have troops before that. I was the NCOIC of SPD, and I transitioned into a spot out here. I did not have any troops, and as great as that sounds, not to have troops, not have to deal with EPRs and things like that, I feel like it was a setback in my, a little setback in my career. You always have to go look for opportunities, kind of sit in with your supervisor, in my case, is Sergeant Smith, and kind of see how the EPR process goes, especially if you're a newer staff sergeant. So I think that was one of my dislikes. And another one of my dislikes was just San Antonio, having to go to like Lackland for a medical appointment, then having to go all the way to Randolph for a dental appointment, different things like that. When you come from a smaller base, everything is in that small base. I came from Wright Pat. It's not that small, but everything was either in area A or area B. I didn't have to travel across, Dayton to get to a medical appointment. So just, those are a couple of my dislikes.
That's a good one. And what can you do with the experience after the military? So the very, very nice thing about being here at MRTC is that they offer a lot of FACD courses. And if you're thinking about getting out of the military for any reason, they will set you up to be a GS 15 or whatever you want. Miss Battles works over here, and getting your master instructor so that you can go and instruct in different places. I'm just one of those people who just genuinely love to instruct. So I was really excited to hear that. The courses are no longer than about a week and a half to 2 weeks. And now that we have all these contractors here, you're actually able to take a little more time away and go TDY to go to these different courses. And they just teach you so much, like how to develop lesson plans, how to be a better instructor, how to, all kinds of different things that just set you up for either teaching the classes in the future or potentially writing lesson plans for other courses. So it's a lot of opportunities that can definitely help you once you get out of the military. And then how to apply selection process. So if you go on AMS and then you go to SpecCat, you just follow the guidance for the AETC T-coded instructors. And you can go ahead and hit the volunteer button there. But I will say, before anyone decides to volunteer, it is on AMS right now, and it is available until September 15th. The only thing I will say is you do not have to have deployment experience. No one is going to say, okay, you did not deploy, you can't come here. However, it is in the best interest of you and everyone who comes out here to have at least deployed, whether it's just to Afghanistan. Definitely be beneficial for anyone who's deployed GST. You'll be able to add a lot of input and insight to people who come out here to visit, or any of the students. So no one's going to turn you away. And then as far as shreds, anyone can apply, but we don't do a lot of ortho out here. We don't do a lot of ENT out here. The only kind of cases we're doing is general neuro
Occasionally.
occasionally, yeah. So you're definitely more than welcome to come out here, but just want to make sure you're making, like I said, you're making that decision to come out here for the right reasons.
Cardio. Yes.
Cardio, a lot of cardio. So
before we continue to the questions, I did just want to touch on the fact that we work with LPMs, which is a live patient model. So anyone who's been out here to EMEDS, GST phase 2, you know that we work with pigs, and you have to be comfortable with that. I think that was one of the things I knew that was going on out here, but then there's a lot of extra duties with the live patient models that we deal with that it did take me maybe like 1 or 2 courses to adjust, which it might take you as well. But I want to make sure that whenever you apply for this position, understand that and make sure that you are comfortable with that. So we'll go ahead and open up to the questions.
Prerequisites to being a good instructor.
Yeah.
You answer this?
Sure.
Okay, so what prerequisites are necessary to be a good instructor? I feel that being a good instructor out here, it is very difficult to deal or to speak in front of people if you don't do it all the time. And then going to BIC kind of helps boost your confidence. And then the more courses that you teach, I would much rather prefer to talk to people in person, because I feel like you can do like the interaction and you can kind of get feedback from them. So I really prefer to have someone physically in front of me when I'm talking to them. But I would say the prerequisites would just be the number 1, have a personality. Number 2, be open to feedback, because so many different people are going to come out here and critique your every word, no matter what you say, no matter how you say it. Everyone in the room automatically becomes a BIC instructor as soon as you start speaking. So it's very good to just be open to feedback, because we don't have all the answers. There is someone that probably speaks better than us or that has more experience speaking than us. But at the same time, it could hurt your feelings, or you might get in your feelings if someone says something to you. So just be open-minded, have a good personality, and just expect feedback, and then be ready to grow with the feedback that's given.
And then what travel opportunities are available as instructors? So personally, I was able to go to the CST conference just to get that background and to keep my clinical mindset and continue that. So I did that last year. I was set to go to to go to SMART training in Las Vegas April of this year, but unfortunately because of COVID, I was not able to go. A lot of these things you can look out for as a surgical tech so that you could continue your skill set or your actual like AME standard, AORN standards. Make sure you have those in mind, because we are out here doing dirty surgery, semi-sterile. So sometimes whenever we get caught up in this, we don't keep up with things or we just forget them. What was the other one?
What?
The TDYs.
For what?
It's okay. We could go to
this. What's the most challenging aspect of the EMEDS course? So the most challenging aspect of the EMEDS course, I wouldn't say the EMEDS is challenging. I think that it's more, it's just something, you're gonna learn something at every course. But I mean, if I just had to pick something challenging, I think it would still just be the heat. It just gets really hot out here. I mean, and now with the mask that we have to wear, it just really plays a toll on your whole life. Like, I'm being completely serious. But as far as challenges, I think the group of people that we work with together here, we're a really good team. We're close-knit. If we have issues, we're all adults. We go to each other. We pull them aside. We don't interrupt people when they're instructing. We're very respectful of people, even if we don't see eye to eye on certain things. So I think the actual group that we have out here makes EMEDS fun. So I wouldn't really just say a challenge. And then all the different people that you get to meet. It is networking at its finest. We meet people from every different place who know all kinds of different people. So I would say the networking is also really good. I mean, I can't really think of like can you think of another challenge?
No, I don't
Heat.
think so.
It gets hot. We both agree on heat, yes.
So what are some things that you learn as being an EMEDS instructor? Personally, we learn a lot with, especially whenever we have surgeons from CMC or just surgeons that come through who have deployed GST. We even had a surgeon come through who was special operations surgical team SOST. And we just learn a lot from their surgical capabilities, how they would do that specific surgery and things like that. So personally, I've learned how to, start an X lab, look how to pack from start to finish, how to look for injuries, what kind of, what do we need, and how to fix the specific injuries. That's my personal on what things that I've learned. I've also learned how to instruct, of course, how to have a structure foundation. And do you have any more?
I was just gonna say that we're residents. Sergeant Aguilera and I, before the contractors got here, it was just us. And so whenever we had to do the interventions on the LPM, we have to walk the docs through. And a lot of the doctors, you would just say, okay, they've all been through medical school, but they're residents, like they're fresh out. They just came. So a lot of the things, we have been out here so many times and we understand and we've learned that we're actually able to walk them through certain procedures. So I think the amount of information that we learned is we joke around and say that we're residents because we are far beyond just your average scrub techs now. I mean, that is what the LPM. I mean, I don't want you to think we're real surgeons, but we definitely get a lot. We joke about that all the time. So I would say that that's one of the bigger things that we get out here, just that experience of doing these procedures and actually walking them through, mostly because we see them over and over again. So we understand what's supposed to happen, but it's just kind of sparking our minds to do things that we probably wouldn't even think of. So.
You mentioned master instructor. What else type of training? CIC, CCAF.
Okay, so as far as we used to get our CIC, I believe Sergeant Spencer, yes, was the last person to get her CIC 3. We actually don't get those anymore. So I actually got my CCAF, and then I got my CCAF and instructor degree. Those are the only two I have right now. So the CCIE 1, CCIC 2, and CCI 3, we don't get those anymore. They took those from us because either we didn't have enough instructor hours or something, but I know that a lot of people are working countless hours to get that back for us. But at this point, we do not have those opportunities anymore.
By the time I got here, the opportunity was already taken away and I wasn't allowed to apply or go that route.
So.
You're required to maintain CMRP requirements.
So our CMRP requirements, our wing Sergeant EJ has been working with us to keep us spun up on that kind of stuff, our CMRP. And as far as scrub hours, we don't really scrub out here. So we get in touch with Senior Master Sergeant Wick, and anytime we do scrub, we just have to document that we've scrubbed and then we can send them to him. But since we're more of SMEs out here and we don't actually get the scrub hours, we just make sure that we communicate with our functional to keep him in the loop of anything that's happening.
All right, if there are no more questions, then we'll turn it over to Senior Master Sergeant Nahar.
Am I on? Can y'all hear me? Am I on? Can y'all hear me?
Yes, sir.
All right. So I just wanted to kind of put in a little bit of plug. You guys did a good job covering some of the things, majority of the things that you guys do as an EMEDS instructor. I actually was an EMEDS instructor from 2014 to 2017 with Master Sergeant Almeida. So yeah, you guys brought up the points that in my opinion, the most challenging thing is the wear that it has on your body. Yes, you're out there, the brutal summers of San Antonio, also the rocks that you're walking on, walking around with a lot of the gear, and so there's always a potential that it can put a little bit of strain on your body. I felt like for the first, I think my second, third year that I taught, I felt like my knees, my ankles were pretty banged up just because of the fact that you're out there and walking around in rocks and unstable, field conditions for that period of time. So that would definitely be something that I agree with y'all. There's a lot of opportunities that you guys mentioned, the networking. That's all I did for the 3 years that I got people to come through. Obviously, being an instructor and you're not in a medical treatment facility, you don't have the ability to stay in the loop with what's going on with your peers, your people in our career field. So that kind of allows you to keep in touch with what's going on with different bases. Because I felt for the 3 years that I taught that I was not aware of what was happening, and so that definitely is an opportunity to not only network, figure out what's going on, so that you stay engaged of what's happening in the career field. I definitely, there's so many other opportunities. You mentioned Sergeant Smith, regarding you can teach. It's very similar to phase one. You do have to attend basic instructor course. And so it gives you the ability, if you're one of those people like her that likes to teach, there's opportunities where you can, do that if you decide to get out or retire from the military. I mean, we got somebody that's online, Mr. Patterson, Jay Patterson, who is currently working with simulation. So there's not only live tissue, but there's also a lot of simulation that takes place out there in Camp Bullis. So there's opportunities to come back and be a contractor or civil service, like Sergeant Smith has mentioned, GS-15, not quite that high, but at least opportunities for potential job opportunities after you retire from the military. So the positions are staff sergeants. Obviously, if you get promoted, there is, that flexibility of having people there that are tech sergeants, like both of y'all. So I was there. I actually got there as a tech sergeant and got promoted to master. So I was actually sitting as a master sergeant in the staff sergeant spot. So understand that those were just the opportunities that I took when I went out there and taught EMEDS for the 3 years. But I had asked the question, and I don't know if you guys saw it. And this is something that I really enjoyed the most. It was understanding that I could be the best surgical tech in the world, but there were so many other things that I learned. I remember two instructors in mind that come to mind who were one of the best 4.0s that I've ever worked with that taught me so much. One of them actually taught anatomy lab. Once some of the live tissue were in the operating room, the member would come over and just teach the students anatomy from head to toe, and mentioning some of the injuries that you typically see, and so I learned so much from that. Also from some of our radiology techs, from the cardiopulmonary technicians, the 4AOs, the logistics, BMET, to the point that you start to learn a little bit of each other's roles and jobs. So in my opinion, that's beneficial when you go back to the MTFs and you kind of understand what they do. But also if you deploy, what exactly that their roles and how you can play and that capacity, or feel comfortable and not just doing your job, but being able to do different things when you're downrange. So I definitely took that. And to this day, I feel like it made me a better technician, a better medic, just knowing the skills and just listening to some of the other instructors, even some of the subject matter experts that would come out there and help us assist with the ground surgical team course. I was able to, come out of there as a better person, just the knowledge that I learned. I know y'all mentioned the term of being a resident. That's I kind of relate to that, being at Wolford Hall back in the day when we had residents there. I would just pass instruments and hear the attending tell the residents what they were doing, what are some other complications that this patient could be having. So that was an opportunity for me to obviously hear, from that perspective of being knowledgeable, not only the anatomy, the procedure that was going on. And that's the same mentality that you have to keep in mind when you're out there. It's not, you're just gonna be out there doing surgery on on pigs or in simulation mannequins is being an overall medic that could potentially use that skill for point of injury. If you're deployed or, assigned to some sort of ground surgical team or part of an EMEDS, that you're able to use the skill sets that you learn by being out there, not only as an instructor, but when you do go through the course, and just be open-minded to that. Because at some point, you start to see the same thing over and over. Sometimes you do get that oh man, it's another course, but the difference is just the dynamics of the teams that you work with, especially in the operating room. Sometimes that can be pretty interesting, I'll put it that way. But yeah, this has been such a great opportunity especially for those folks who had the experience of deployment, that can bring that personality, that skill set, that background to teaching some students that never deployed before, or maybe the deployment wasn't what they thought it was, and there wasn't much going on. So definitely being able to share those experiences with people and passing it forward, so that they're better prepared when they go downrange than they were before they took the course. So definitely a lot of opportunities for being an EMEDS instructor. And one thing that I don't recall that they mentioned was opportunities to possibly go TDY and actually teach that course. When I was there, we went to Wisconsin to train reservists and a guard units up north to build EMEDS from ground up. So that was pretty interesting, very great experience as well, because at the time when we were teaching EMEDS, we had everything static. So we just kind of walked through the motions. This is what you would build your site. And the curriculum has changed to the point where we're teaching the students to build the tents from ground up, just like they would if they were delivered to, their site, their fob downrange. So that definitely brought a lot of value to the curriculum. Definitely, if you're out there and interested in it, reach out to Sergeant Smith and Sergeant Aguilera to figure out if this is really something for you, or if you ever went through the course and thought, man, this is really something that I'm interested in, so that we can get the right folks in the positions. Because yes, they have to move on, and one of the positions is advertised in AMS. So if you're interested in considering it, reach out to those members. You can reach out to me, reach out to Sergeant Almeida, anybody who's taught the course before, and give you the down and dirty, and the things that may not necessarily not been covered during this virtual town hall. But if you're interested, good luck, and see who we select or who gets selected for that position, because it's really out of our hands. It's pretty much making sure that they meet all the requirements based on the spec cat that's on the job advertisement. But yeah, definitely loved it. And thank you guys for sharing your experiences and your expertise in this particular subject, and appreciate y'all. And if y'all need anything, reach out to me. You got my number, Sergeant Smith. So thank you so much for what you guys do.
Thank you.
Thank you.
All right, thank you, ladies, for presenting today, and thank you, Sergeant Nahar, for your words. Our next one is going to be over GST deployment in general. So we actually have two guys that are going to join us for their experience with the GST deployment and how they differed from each other. So that'll be on September the 16th, keeping it at the 1700 Central Time. And I hope to see you all there. Thank you very much.